Hello, I'm Dickie Suttle, the Chief Digital Officer at PATH, the leading global NGO advancing innovation for health equity. As an organization, PATH is incredibly proud and excited to work with AHIN, critical network for advancing digital health and data use across Asia. AHIN has long been an exemplar for creating a thriving community for practitioners advancing digital and data transformation for health across the region. Today, I want to share a few thoughts on PATH's work in 2020 and what we're excited about for 2021. As with many of you, we pivoted our work to support the COVID-19 pandemic. The pandemic has inevitably shifted our focus for the last year as countries lean on digital and data systems to understand and coordinate response efforts. Over the course of 2020, PATH has worked directly with countries like yours to adapt existing systems and data sources to meet these urgent needs. The PATH-led Digital Square Global Flagship Initiative for Digital Health is working to landscape existing digital technologies and how they can be applied to the COVID-19 response. The initiative has also helped catalog COVID-19 adaptations to digital health global goods, and we co-chair the OpenHIE COVID-19 Task Force to ensure technical standards support greater coordination in response efforts. We're also thinking deeply about how digital technologies and data support public health emergencies. We hope this work can guide technologists and decision makers to build stronger, more resilient health information systems in the future. We're also proud to support an engaged global digital health community. The passion for digital health and data use has only grown in the last year, and more governments, donors, and partners are committed to collaboration than ever. We've seen this community pull together around COVID-19, but this commitment to collective action will exist long after today. As a community, we are transforming health globally. We've also been partnering with new collaboratives like the Transform Health Coalition and the Lancet Financial Times Governing Health Futures 2030 Commission to advance critical conversations about equity and the future of health in a digital age. These coalitions bring in new voices from private sector partners to youth ambassadors to expand our community even further. In 2021, we hope to continue expanding this community and the frank conversations about how digital technologies and health data can and should uphold a more equitable future for everyone. I'd like to turn it over to a few of my colleagues to provide some additional updates, and thank you again for your participation and leadership in AHIN and the 2021 General Meeting.
Wow, what a year 2020 has been, isn't it? In one stroke, it has made the public health world more digital than ever. In my 15 years of career, I have never seen such a dramatic migration, ever. On this note, I want to start by wishing everyone a very happy new year and hopefully a far more healthier and calmer 2021. I am Kanishk Katara and I lead the digital health portfolio for the South Asia Hub of PATH. We have seen this digital shift play out on a very real basis in our programs across HIV, TB, NTDM and nutrition. As a core foundation of our digital health work, we believe that systemic digital strengthening is one of the key elements to ensure the desired transformation of the public health programs and thereby promoting health equity in the society. More so for the marginalized sections of the society. If one looks at it, the digital health interventions can be broadly classified in four following segments. Segment 1. What happened? Does your system inform what happened? Number 2, why did it happen? Number 3, what will happen? And number 4, how will it happen? Now, by all counts, it appears that almost 90% of the digital health space comprises of the what happened and why did it happen interventions. As part of PATH, we have been focusing our energies on the transition of public health programs from the what happened to the what will happen paradigm, while also identifying opportunities for considering the how will it happen interventions. Let me pick a couple of examples to illustrate the work we have done under the what happened and why did it happen segments in the year of 2020. Number 1, we have helped with the development of a national and central TI dashboard for the HIV program in India. This would help in making the information and indicators available to the program officers in a very intuitive and easy to refer manner so that it helps with decision making for the necessary programmatic interventions. Number 2, in the nutrition space, we are working closely with the Government Medical College in India to develop a comprehensive digital solution to support the human milk banking program under the larger umbrella of the Comprehensive Lactation Management Initiative. The solution would help the healthcare providers with real-time information on the infant cases who are in need of critical care and support, as well as provide availability of the milk units at the given facility. This would also provide a mechanism for the willing donor mothers to connect with the nearest centers for milk donation. Now, while these interventions are full of impact in their own ways, it is the what will happen and how will it happen segment which personally excites me the most, as I believe that it has the maximum potential for making the public health programs becoming more ready and responsive to the beneficiary needs. Let me share a couple of very exciting interventions where we have been involved in 2020. Number one, in the TB space, we have been partnering with one of our digital partners, Cure.ai, for the implementation and scale up of AI-based X-ray tool for screening of TB cases. This specific intervention has shown a tremendous amount of positive potential in terms of screening accuracy and also bringing in time efficiencies, thereby reducing the burden on the health practitioner staff who so far has been manually screening the X-rays. This also opens up a lot of potential possibilities for other lung-related infections, as well as some very promising cough sound-based COVID screening tools. Number two, in the public health supply chain space, we have worked very closely to develop an AI-based mobile application to detect, identify, and count a given family planning product which is kept on the shelf or within a storage cabinet. Now, all of this is done through a photograph click from the smartphone. It is as simple as that. We see this as a very exciting development which can help a number of public health programs, including the immunization campaigns, on their respective supply chain ecosystem, including inventory management and also helping predict for better provisioning of products. Last but not the least, I would also like to mention that we at PATH take a lot of pride in our ability and actions with respect to privacy and security of data. We have developed and implemented a comprehensive data governance framework to equip our program staff and employees with the right set of knowledge, SOPs of do's and don'ts for the program data, as well as the local regulatory requirements vis-a-vis data handling. This is a unique initiative in this space and is aimed at promoting the right behavior as part of the program work. Now it is time for me to take a pause in this conversation. I'll be happy to connect with all of you again. Please feel free to reach out to me to know more about any of the aforementioned initiatives, as well as a number of other initiatives which I didn't get a chance to mention here. Let us go and make a difference in this world. We have a lot to cover, including the entire misery year of 2020. Thank you so much. Have a good day.